Dear friends, I am so happy to meet you once again this Saturday, 24th May 2025. We have finished 1,578 cases of Puberphonia. Really, we are aiming for a great achievement, and I hope the awareness will come to the public all over India. Why not all over the world? That we will be able to treat easily Puberphonia. And the boys affected by Puberphonia are many in number, unrecognized. So this is a virtual field that we have to trace those who are having Puberphonia and we have to treat it. So we are doing a lot of social work. You know that in the name of publishing Marthuva Real Malar for the last 28 years and conducting Maruthuva Real Monad every year and doing free medical camp and many activities. Wherever I go, I talk about the care of the boys. Now, I personally feel I got a chance, I got an opportunity that we have to create yes public speaking powerful voice seminar in all over every village and city, because this will trace who are having defective speech problems. So this will give a great note what more we can do for the public. So I'm thinking, why not we create a manly voice center for adults? Because many people speech or voice disorder can significantly impact communication. This speech disorder affect the production of sound, while voice disorder affect the quality, pitch, or loudness of the voice. These disorder can be caused by various factors, including the structural issue, neurological problem, and or functional misuse of the vocal mechanism. So this I want to take it to the public as a service center. All over I want to do it. So I had now I am having an opportunity to come to various places to give a talk on care of the speech. The speech disorder may be a sound disorder, which is a difficulty in producing or perceiving or representing speech sounds. Second thing is childhood aphasia of speech. So it we usually called as apraxia, difficulty planning and coordinating the movement needed for speech. There comes stuttering. There is a disruption in the flow of the speech, which may be manifested as a repetition or prolongation of the sound. Then puberphonia, the persistence of child voice or female voice in adulthood male that can occur mostly in male. Females also it can occur, puberphonia. That is the adulthood voice change. Dysarthria or weakness or incoordination of the muscles involved in the speech. That is called dysarthria. So these speech disorders, if we are able to find out, we can treat it without, we try, that's all, without surgical intervention or medical intervention. Because most of the disorder, the anatomy is normal, means the airflow we can change and make it all right. So this voice disorder can be divided into functional voice disorder, organic voice disorder, or even neurological voice disorder. So then there are many problems can occur because of the neurological problems also. So it may be a functional, organic, neurological, or any inflammation we call as laryngitis. So the larynx get inflammation. Then spasmodic dysphonia, a nerve-related disorder causing spasm of the vocal cord. Spasmodic dysphonia. So the voice disorder can be functional, organic, neurological, inflammation, or spasmodic. When you come to symptom, the speech orders, difficulty in producing clear and understanding speech, which may be in the form of repetition, prolongation, or unusual pause in the speech. The voice order may present as hoarseness, breathlessness, weakness, strained voice, change in pitch, loudness, voice quality, pain, and fatigue in the throat while speaking. That is called lazy throat. Hypofunctional larynx. When you think of causes of speech order, it can be caused by variety of factors, including neurological problem, development delay, and injury. So when you take this voice disorder, it can be caused by misuse, overuse, abuse, trauma, underlying medical condition, because everybody know in thyroid, voice will be affected. GERD, another problem, regurgitation of food in the gastro, in the esophagus. That causes laryngeal edema, vocal cord edema, false vocal cord edema. Simply we say as GERD. And neurological disorder. So these can cause a problem in the voice. So the treatment option, first one is only speech therapy. Involves the exercise strategy to improve the voice production, fluency, and coordination. The second one is voice therapy. Speech therapy is different. Voice therapy is different. Voice therapy focuses on improving vocal technique, posture, breathing to reduce vocal strain and improve the vocal quality. That's what we are more interested in voice therapy. Definitely, most of the cases now medicines are available, botox injection, surgery, thyroid framework surgery, or other procedure to address the underlying medical condition where a, a structural abnormalities is there. So, what are the types of voice disorder? See, we are going to a camp and analyze the voice disorder. Mostly, we are thinking of doing only for adults. So, common voice disorders are laryngitis, that is the inflammation by bacteria. Voice changes related to brain and nervous system known as spasmodic dysphonia. Another common condition in the teachers, street vendors, politicians, those who use voice or misuse the voice or abuse the voice, polyp, nodules, cysts in the vocal cord. Then there are these misuse, overuse can produce precancerous and cancerous growth. Definitely, vocal cord paralysis and weakness forms another group. Can this voice disorder can be cured? Definitely, most of the voice problems can be reversed by treating the underlying cause. It may be a behavioral or a surgical treatment also. So, how to use a overuse voice? Somebody says, "My I'm a teacher, I am overusing the voice." Definitely, self-care methods, home treatment, relieve the symptom of laryngitis, reduce strain in your voice. Yes, teachers can follow, politicians can follow. Those who use their voice for their profession, actors, playback singers. So what they have to do is breathe moist air, give rest to the voice as much as possible. Drink plenty of fluid to prevent dehydration, but we should avoid alcohol and caffeine. Frequently moisten your throat. The important thing we have to note is avoid decongestions. See, decongestions medicines also make your throat dry. Antihistamines, menthol. You have to avoid whispering that will damage the vocal cord. So, what is meant by a neurological disorder? So, we have to understand some when they speak, there is a spasm of the voice box occur, which is called as spasmodic dysphonia, a neurological voice disorder that can affect the voice muscles of the larynx or voice box. It is called spasm of the larynx, spasmodic dysphonia. This spasm causes the voice to be interrupted and affect the voice quality. Spasmodic dysphonia can cause the voice to break up and to have a tight, straight, strained, breathy, whispery, and strangled quality voice. Which is the best medicine for the voice? Many people will ask. Yes, increase the mucus secretion. So mucolytic agents can be used, which help to keep the respiratory secretion thin and flowing. Yeah, mucolytic agents are available. But overall, how to improve my voice? That is the thing many people are asked. How will you improve your voice? First, listen and record your voice itself and listen. Note what do you do and do not like about your voice. Slow speech, slow down your speech deliberately. Drink plenty of water. Be mindful of your body. Listen carefully to others' voices, which you may like it. So these are the fundamental factors will help you, or it's a tips to improve your voice. So you need a normal voice. When there is an injury to the voice or voice box, the voice change. So if you want to get back your quality of voice quickly, first thing is rest to your voice. Wonderful idea. Voice rest is the primary treatment for laryngitis, inflammation of the larynx. Moist air is good for laryngitis, so breath, steam, hydrate the throat and gargle. Pain reliever can be taken along with lozenges. Smoking, 100% you have to avoid. Spicy food, better to avoid. Get adequate rest, very much needed. So, definitely, all voice problems, there is a good treatment provided you take some interest. Do voice order, let's go away? Yes, definitely it will go away. So definitely we can make it all right. Even in the case of paralysis, you can improve the voice. So definitely the diagnosis of the underlying problem is very important. So definitely vocal exercise, variety of technique, including breathing, relaxation, and vocal tract exercise to relieve hoarseness, vocal fatigue, difficulty, different pitches and volumes. So the voice disorders are great in number, and we have to find out what is the problem behind, and we have to treat it. Nowadays, medical treatment is or strong. We can ask the patient, depending upon the diagnosis, we can suggest rest, take plenty of fluid, and voice therapy, allergic treatment, stopping smoking. But now there are some surgical procedure, if a growth is there, it has to be removed. Another great medicine had come to relax the vocal cord is a botulinum toxin. Even it can be injected, tiny amount of the botulinum toxin can be injected to the skin of the neck and help muscle spasm and unusual movements. This drug treats a moment issue related to the brain and nervous system. So in spasmodic dysphonia, which affect the vocal muscles of the larynx, botulinum toxin is very good. Another thing is vocal cord not moving. That is a paralyzed vocal cord. This can cause choking when drinking liquid. Sometimes the problem goes away in time. So if the problem does not go away, one or two procedures can push the paralyzed vocal cord close to the midline. So if you are able to do some surgical treatment to the paralyzed vocal cord, now the famous procedures are fat or collagen injection. Injecting body fat or human-made collagen either through the mouth or skin of the neck add bulk to the paralyzed vocal cord. It also treat vocal cord weakness when the mass is increased. Another famous thing is there called thyroplasty, a small opening created in the tissue called as cartilage from the outside of the voice box. A surgeon put an implant into the opening and pushes the paralyzed vocal cord to the normal level. So these are the things available. So we are in a correct pathway to create and awareness by bringing a revolution in the treatment of voice. We are a public speaking platform we want to create. Students, working people, housewife, anyone. Good quality of voice increases your productivity, increase your appearance. So we are going ahead in producing more centers for public speaking outlets. So I am so happy to meet you this Saturday, 24th May 2025. We have completed 1,578 cases of puberphonia. So thanks for the God who had given a great opportunity for us to go ahead, treat puberphonia. Today also we have treated one case of puberphonia. We are so astonished. The boy got the voice immediately with our Kumar training by redirecting the laryngeal voice to pharyngeal. But it has to be a conditioned by repeated training to the vocal cord. Redirecting the phonation from larynx to pharynx will give him a great care. Thank you. Great. Hope to meet you next Saturday, same time.